Hi, everyone. We have Morgan Krauter with us here today. Morgan, why don't you tell everyone about who you are and what you do?
Great, thanks so much for having me. My name is Morgan Krauter, and I'm a nurse practitioner at Southlake. I'm the heart failure consultant, part of the group of our cardiology program there. I was lucky enough to be introduced into our group there as the inpatient heart failure nurse practitioner, who also has a role in the outpatient clinic. So it's a unique role for the nurse practitioner within our group.
Wonderful. And so today we'll be talking a little bit about the role of nurse practitioners in extending heart failure care and improving heart failure care as well. So why don't you tell us a little bit about some of the things that you do as a part of your role as a nurse practitioner in heart failure?
Yeah. So traditionally speaking, nurse practitioners in heart failure management find themselves in a heart function clinic or as part of an outpatient chronic disease management clinic. Southlake took a little bit of a different approach on that and introduced a nurse practitioner for specifically heart failure management. This was in order to address the issues that they were having in some of the medicine patients who had longer length of stays and increased readmission rates compared to patients who were admitted under cardiology. So essentially, I work under the cardiology program at Southlake, but am an extension of the program into the medicine program. So patients who typically come in with heart failure but are maintained under medicine, so who have complex diseases, frailty, that sort of thing, who don't necessarily meet the criteria to be admitted under the pure cardiology program. They are adopted under me. So I act as a consultant with the medicine group, and it provides me an opportunity to not only help to diurese, but also optimize guideline medical therapy, as well as transition them into the outpatient setting to our heart function clinic. So we've really increased our referral rates to our disease clinic, so which has been a great addition. And not only that, I've been able to follow them within the outpatient setting. So I work 2 half days a week through our heart function clinic as a means to transition patients from the inpatient to the outpatient setting. So I see them either in person or also virtually for patients who are in a long-term care home who can't come to visit us. So I am able to create a great bond with the families, the patients, as well as the primary care providers who now also refer to me for outpatient management virtually.
That's really fascinating. And especially in the context of the current COVID outbreak, doing virtual care is quite important. Can you tell us a little bit about your experience with virtual care amongst patients with heart failure?
Yeah, I think virtual care is a great option. And, pre-pandemic, I was using this a lot to manage our patients, and it's just embedded nicely into our COVID-19 pandemic care. I think that virtual care offers patients who are frail, who have issues with mobility. We also, like many other centers, treat patients from far away. So when able to utilize that hub and spoke model where patients can go to their hospital that are closer to them. There's some challenges in that. Obviously, you want to rely on a good volume assessment. Sometimes we really need to assess the patients. But I think that there's ways to work around that with nursing care, extending to home nursing, utilizing community paramedic programs to reach out to resources in the community that can help us serve our patients better.
And so, do you feel that your role in managing both the inpatients and outpatients gives you a unique perspective on heart failure? And if so, what are some of the perspectives that you have gained from this dual role?
Yeah, absolutely. I think that the most important piece that's highlighted in this role is the continuity of care. So having a provider who's met the patient during an exacerbation when they're at their worst,
Mhm.
being able to create the relationship with that provider to see them through to home creates a element of trust, and as well to see patients through. Also, the intricacies of medication titration that we see at the inpatient level that doesn't always get translated to the outpatient setting. For instance, perhaps you did try the the ARNI really early on, and it didn't work, and patients ended up on an ARB or an ACE because of that. And then to retrial it later, you already sort of know how the patient's hemodynamics might work, or how they might respond, or the beta blocker and the fatigue. So I think picking up on the nuances of medication titration has been really helpful for me to gain more experience in confidence in starting patients on medications. There's lots of benefits to having someone, a familiar face, for not only sort of tying up the loose ends for medical management, but also from a holistic perspective for patients to have someone that they know that they can call on as well.
And so with regards to some of the unmet needs prior to you starting your position, what do
Mm-hmm.
you feel were some of the gaps in clinical care that a nurse practitioner can really add to in order to improve the quality of care delivered to our individuals with heart failure?
Yeah, as I previously mentioned, the continuity piece, I think, is by and large the largest unmet need of patients transitioning from the inpatient to the outpatient setting. We hear a lot about patients getting mixed up in that high risk period, and that 30, where the readmission rate is so high in those 30 days after hospitalization, that as much as heart function clinics try to meet that need, the wait list can be long, and patients can't get into their family doctor or see their cardiologist. So we've seen great benefit of having a single owner in that, and not just assuming that a clinic or the other provider will pick that up, but having someone who saw the patient through their admission and is able to follow up. So I routinely see patients between 5 to 7 days post-discharge, if not sooner, and giving the patient information to call the heart function clinic, even if it's as soon as 3 days, and knowing that they can reach someone has been extremely beneficial. So I think those transition points where patients are at higher or highest risk of readmission, having a provider who's dedicated to that role has been tremendously useful.
When you started working, Morgan, what were some of the challenges that you faced as a nurse practitioner in the role? And what were some of the things that you did to overcome those challenges?
I think the early challenges were part of my own professional development. I was a brand new nurse practitioner with no prior experience, even being a nurse practitioner, let alone working in cardiology, and then throw heart failure management in on top of that. So I think professional development played a huge role in gaining the confidence to be part of teams, and also working on the relationships with my fellow physicians and nurse practitioners. I think finding a mentor is huge. That was probably the biggest benefit, was seeking out someone who was senior and who was respected within the organization, who I had a good relationship with, to continue to develop not only in a professional capacity, but also those that I could turn to from a clinical perspective initially. So I can remember when I first started, feeling the need to review every case with my cardiology colleagues to make sure that I hadn't missed anything. And now I would say that I think they get annoyed if I come to them with a consult because they're so confident and just sort of are like, no, you're fine, go. So I think that mentorship is huge to build not only your professional self, but also your clinical capacity. The guidelines are also always changing, and I think that staying up to date with heart failure management or anything in medicine can be difficult. So attending all the updates and conferences and looking outside of our little organizational bubble into the larger heart failure community.
And so as we wrap up this interview, all of us are under some type of social isolation. What are you doing to pass the time and to have some fun?
Just trying to really disconnect from work, to be honest. The weather hasn't been that agreeable, but I've been running, and typically I actually train in a type of martial art called Brazilian Jiu-Jitsu. So I've been trying to set up some mats and get some workouts in while I'm home, and enjoying that as well. And just some downtime to read those books that I always tend to avoid. So I hope everyone else is staying safe during this time as well.
Sounds great. Well, thank you so much for your time. I really appreciate your comments today.
Thanks so much for having me.